It's 4:40 p.m. here in Seoul. I'm Devin Whiting at the Arirang News Center, and it's time for today's briefing from the South Korean health authorities. We should be getting updates on the latest case numbers and trends, possibly the distancing rules across the country, and the vaccine campaign as well. It looks like they're getting ready to start. Let's listen in.
We're providing sign language translation. First, we will hear from Director General Son Young-rae about the countermeasures against COVID-19. I'll start the regular briefing for Sunday, August 1st. First of all, I'll update you on the latest developments for the past week. Over the past week, on a daily average, there were 1,506 newly confirmed cases per day, and compared to a little more than 1,400, there was an increase. And for the metropolitan area, which is the area of focus, on a daily average, there were 990, 966 newly confirmed cases. So we have seen that it hasn't expanded, so it is actually quite stagnant. However, right now the size is still large and we're not seeing a clear reduction. Therefore, we are at risk. And there are also other issues. For the non-metropolitan area, for the past 3 weeks, it was at 358, 499, and last week it was 546. So we are seeing that the trend is actually increasing in the non-metropolitan areas, especially for Daejeon, Gyeongnam, Gangwon, and Jeju Island. The infection is quite large as compared to the population, and we are seeing that there has been a continuous increase. And for reproduction, it is at 1.04. However, for the metropolitan area, it is actually a bit lower than this, while for the non-metropolitan area, it is quite large. Right now, we are seeing that with the increase in the number, we are seeing an increase in other numbers as well. And last week, there were 280 people who were severely ill, and 27 people passed away for the past week. We pay our condolences to the deceased and to the family members. Right now, as of August 1st, we still have 360 hospital beds available for those who are critically ill. And for those who are with medium illness, we still have room for around 2,200 hospital beds. And for the mild symptoms, we still have more than 6,700 hospital beds at the living treatment centers. Right now, we are seeing that the spread is actually becoming stagnant at the metropolitan area, and for the non-metropolitan area, the speed of the spread is decreasing. However, we are still seeing the infection itself spreading across different regions. And for the Delta variant, it is still actually infecting others, and we also believe that the holiday season is one of the influencing factors. And we want to ask our citizens to actually bear with it for just a little more and to make sure to cancel any gatherings or trips. So we ask you to participate so that we can decrease any contact. And by doing so, we believe that we will be able to see a reduction in the metropolitan area and also be able to curb the infection going further into the non-metropolitan areas as well. So we want to ask our citizens for your cooperation. Vaccination is once again smoothly going on with the restart. Yesterday, there has been more than 220,000 citizens who have been vaccinated. Over the past 6 days, we have seen quite a large number of the first doses being applied. And right now, it is at about 38% of the entire population, and we believe that we will be able to have more than 20 million people be vaccinated by the beginning of next week. And starting next week, we will also start the reservation for the vaccination for those who have not. And if you actually reserve now, we will be administering the AstraZeneca in the period of 8 weeks. So if you are vaccinated, you can curb and prevent infection. And even if you are infected, actually the symptom itself is quite mild, and the risk of fatality decreases, and that is why we are encouraging everyone to be vaccinated. So for those of you who are within 60 to 74 years old, and if you have not been vaccinated yet, we want to ask you to reserve it as soon as quickly. And starting from Tuesday on August 3rd, we will also have the people who are working at the rescue facility centers be vaccinated. And for those who are between 18 to 49 years old, we will also start the reservation for vaccination at around August 9th, and this will be amounting to 17 million population. And also, we will start the vaccination for the non-registered foreign workers in August. For the details about the reservation itself and the schedule, please refer to the press release documents. With the expansion of the vaccination and reservation, we believe that we will be able to curb COVID-19 even more, and we will see a decrease in the fatality rate and those who are severely ill. Therefore, we ask all the citizens to participate in the vaccination campaign. So until yesterday, of the 272 of the Cheonghae-2 who have been vaccinated, a lot of them have been able to be dehospitalized, and most are resting within their troops or at home. And for those who have not been dehospitalized, they still have some mild symptoms, so they are remaining in the hospital. And there were 29 who tested negative and who were in quarantine. And we are going to have them tested once again. And if they are be able to test negative once again, they will be able to be released from quarantine. And the government will make efforts until all the Cheonghae troop members are released from their quarantine and are without any symptoms. And with the heat, we are also supporting some recovery buses across the country. So right now, with the support of the police officers, we have designated more than 30 recovery buses around these screening test centers. And we want to thank all the relevant personnel who have been volunteering and helping us out. And we also want to thank those who have supported with us the buses. And we are also going to make sure to provide additional support for those who are working in the midst of the heat wave. And now I'll update you on what has happened with monitoring of the facilities in the non-metropolitan areas. For the non-metropolitan area, a lot of the people have been assigned to the hospitals instead of the living treatment centers. Therefore, out of concerns that the hospital beds were being occupied by those who shouldn't be, we have taken time to monitor these situations. And when there were hospital beds that were assigned for unclear reasons, we took a deeper look into it. So there were 103 cases that should have gone to the living treatment centers when they were actually first hospitalized. And for the non-metropolitan areas, we want to ensure that such a situation does not happen once again. Therefore, a report was made during the CDC meetings. And also, we have to make sure that the patients are classified as they should be and be hospitalized in the right places. So we're going to strengthen training regarding this. And also there was a discussion about the social distancing measures across the cities and the Gun areas. Right now in the city levels and the Gun levels, we are sometimes applying different social distancing measures. However, right now, considering that the social distancing and the disease control is not stable right now, we have some concerns about the city level and the Gun level adjusting the social distancing as they feel necessary. Therefore, we decided to postpone this until a bit later. Right now, for the cities and Guns to make adjustment to the social distancing measure, they must have a discussion with the city halls, and if they were to arbitrarily make adjustment on their own, then the businesses will not be recovered or be helped out for their losses. Right now, we are continuing to see a large increase in the number of patients. Therefore, we want to ask our citizens to participate in social distancing measures, and we actually want to thank you for having done so until now. We understand it will be tiring and hard for you, but we want to ask you to bear with it a little more and be participating with us in the social distancing measure, and also take part in practicing personal hygiene. The government will also strive hard. Thank you.
네, 지금부터 질의응답 시간을 가지겠습니다. 브리핑은 사회적 거리.
And that'll conclude our coverage of this briefing. Thank you for watching. Arirang News will be back at 6 p.m. Korea time with some updates from the Olympics and more. Bye for now.